Hello friends, in this video we will discuss about the multiple choice questions related to anatomical landmarks in a complete denture patient. So the first question is, the primary stress bearing area of maxillary complete denture is. As we all know that the stress bearing areas can be classified as primary and secondary stress bearing areas. And in case of a maxillary arch, the primary stress bearing area is posterolateral slope of palate and secondary stress bearing areas are palatal rugae and maxillary tuberosity. So the answer for this question will be the posterolateral slope of palate. The posterolateral slope of palate is considered as the primary stress bearing area in maxillary arch. Next question is, which muscle has influence on buccal frenum of maxilla? So three muscles influence the buccal frenum of maxilla. These are levator anguli oris, buccinator and orbicularis oris. So the answer for this question will be levator anguli oris. Next question is, primary stress bearing area in mandibular edentulous ridge is. So in case of mandibular edentulous arch, the primary stress bearing area is buccal shelf area and secondary stress bearing area is lateral slope of residual alveolar ridge. So the answer for this question will be buccal shelf area. Next is retromolar pad. Retromolar pad is a triangular pad of soft tissue and it forms the distal end of mandibular alveolar ridge. So the answer for this question will be that the retromolar pad should be covered by lower denture. Next is denture bearing area of the ridge is. So as we all know that the masticatory mucosa is keratinized and the lining mucosa is non-keratinized, and the keratinized mucosa is more resistant to the stresses. So the answer for this question will be that the denture bearing area of the ridge is keratinized. The next question is, if a complete denture patient has genial tubercle at the level of the crust of mandibular ridge, the denture base. So the answer for this question will be that the denture base should cover them, but relief is must. In the area of genial tubercle, we need to give relief. Next is the retromolar pads as a landmark is. So the answer is relatively stable. The retromolar pad area can be used as a stable landmark. Next is, the purpose of relieving mid-palatine area in complete denture is to prevent. Now, we all know that the mid-palatine raphe area is considered as a relief area and it is present as slightly elevated bony ridge in the middle of palate. So adequate relief should be provided in this area as the mucosa covering this area is extremely thin and less resilient. So the answer will be the mid-palatine raphe area should be relieved to avoid pressure on the palate. The next is, which of the following are stress bearing area? So if you'll see the options. Now in first option, buccal shelf area is the primary stress bearing area. Incisive papilla is a relief area and again palatine rugae is a stress bearing area. So in first option, incisive papilla is a relief area. Next is slopes of residual ridge, palatine rugae and mid-palatine raphe. Again, the mid-palatine raphe is considered as a relief area. Next is incisive papilla, slopes of residual ridge and crust of the residual ridge. So, incisive papilla and crust of the residual ridge is a relief area. And last option is slope of residual ridge, buccal shelf area and hard palate. All these areas are considered as stress bearing areas. So the answer will be last option, slope of residual ridge, buccal shelf area and hard palate. Next is, which muscle has an indirect effect on the extent of impression in maxillary labial vestibule? So in case of maxillary labial vestibule, the main muscle of the lip, which forms the outer surface of the labial vestibule, is orbicularis oris. So the answer will be the orbicularis oris. So if you like this video, then please share it with your friends and subscribe to our channel. And in the end, thank you for watching.